Getting a cancer diagnosis always comes as a shock. It is perfectly normal to be afraid, worried, and uncertain about the future. You probably have lots of questions. You should ask your doctor, nurse, or any member of your healthcare team about anything you want to know. When you are informed, you can make the best decisions for your treatment. Early breast cancer means that the cancer has not spread outside of the breast and the closest lymph nodes to other parts of the body. In terms of stages, any cancer between stage 0 and stage 3A is referred to as early breast cancer. Early breast cancer is usually treated with more than one type of treatment. That means that a whole healthcare team will look after you, with specialists in oncology, radiotherapy, surgery and pathology, as well as specialized nurses. The treatment will be tailored to the type of cancer you have and your own characteristics such as your age and general health, but also your treatment preferences and personal circumstances. Surgery is the most common treatment for breast cancer. There are different types of surgeries depending on how much tissue the surgeon removes. This in turn depends on the type of cancer, the size of the tumor, where the breast tumor is, the size of your breasts and your preferences. Treatment with medicines and/or radiation may be given before the surgery, also known as neoadjuvant treatment, to reduce the size of the tumor before the operation, or after, known as adjuvant treatment, to kill any cancer cells that may remain and reduce the chances of cancer coming back. During radiotherapy, high-energy rays are used to destroy tumor cells. The type of radiotherapy and the number of sessions that you need will depend on the tumor characteristics. Chemotherapy is a type of treatment using medicines that kill cancer cells or slow down their growth. It can be injected or administered as a pill, and it can be just one drug or a combination of 2 or more. Chemotherapy is usually administered in cycles, meaning that after receiving the medicines, you will have a break for some time to recover before they are administered again to start a new cycle. The specific drug or drugs will be chosen by your doctor according to your breast cancer type and how much it has spread. Some breast cancers can be stimulated to grow faster by female hormones such as estrogen. Hormone therapy blocks the effects of hormones on the tumor. This type of therapy is only used in cancers that are hormone positive, as it is not effective in other types of cancers. Like hormones, other substances in the body can stimulate the growth of cancer cells. Targeted therapies specifically block these effects, helping to shrink tumors. Unlike chemotherapy, targeted therapy drugs attack cancer cells more specifically, without harming normal cells, and so have fewer side effects. A marker is an element of the cancer cells that helps to distinguish between different cancer types. If cancer cells have a specific marker, they may respond to treatment that specifically targets the marker. Some of these treatments can be used in people with early breast cancer. Early breast cancer is the easiest to treat, and women with early breast cancer have the highest chances of survival after 5 years. However, there is a chance that cancer may come back. Whether this happens or not will depend on the type and size of tumor you have, how extended it is, the type of treatment you received, for how long you received the treatment, and how your body reacted to it. The proportion of people with early breast cancer who are alive 5 years after diagnosis is close to 100%. The percentage of people diagnosed with breast cancer that die due to the disease has been decreasing for the past years. Receiving a cancer diagnosis has a big impact in your life. and it may be difficult for you to feel hopeful. However, it is important for you to find things that keep you motivated and help you overcome difficult moments in your journey. These can help. Whether it is finishing an art project or finally getting to that book you have always wanted to read, achieving small things will give you a sense of fulfillment. You can also try to do something you have never done before, and each time you achieve one of your goals, be sure to celebrate. It could be gardening, or simply enjoying nature, or spending time with your loved ones, or watching your favorite films. Anything that improves your mood will make you feel better. Talk to your loved ones or share how you feel with people who are going or have gone through something similar, or ask for psychological professional help. It is important to be listened to. At difficult times, it is important to have a source of strength you can rely on. Videos are also available on the following topics: